Hello everyone, welcome to my channel Tooth Fairy. This lecture is in continuation with the diagnosis part which we have discussed in the previous video. So what we have done, we have discussed majority of the options in the diagnosis template and we are left with only 2 or 3 options which we are going to discuss in this lecture. Plus the important thing about this lecture is that we are going to discuss few examples on how to diagnose the pulpal and the periodontal conditions. So let's begin. So we are left with, we have done till vertical root fractures. Now we are going to start with horizontal root fracture, endoperiolesian and external resorption, which are the only options which are left. Now horizontal root fracture. Now as far as horizontal root fracture is concerned, it usually happens in anterior maxillary region. So mainly you will see this in an anterior maxillary region, and clinically what you will see, there is mobile or displaced tooth and patient will complain of pain on biting. When you see the case history, generally there is a history of trauma to the tooth present. Now moving on to the X-ray, when we see, it is not necessary that in radiograph we will see a fracture line, but in X-ray, fracture line is seen only if X-ray beam is passing parallel to the fracture. Okay, so that is the only condition, then that is the only time when you will see a fracture line in an horizontal root fracture. So the important thing to note here is that there is generally the history of trauma and it is mainly in the anterior maxillary region and there is clinically mobile or displaced tooth and the patient complains of pain on biting. Now treatment. Now as far as treatment is concerned, if the fracture is close to the gingival crevice or near it or above it, the treatment of choice is extraction, and if possible, then only remove the coronal part, do the endo, restore with post and core restoration, and crown lengthening may be needed. So the treatment is extraction, or if possible you will do the further treatment. Now fracture, if the fracture is in the middle to apical 1/3 of the root, it generally has a very good prognosis. So what you will do, first you will reposition the displaced tooth. We will take radiographs and we will monitor the position of the displaced tooth. And then we will we'll do firm immobilization for 2 to 3 months and we will monitor the healing. Now during this period, if there is necrosis, if necrosis happens, you will do the root canal treatment of the tooth. That's all we need to know about the horizontal root fracture. Now moving on to the endoperiolesian. In this case, inflammation extends from endolesion into a periodontal lesion. So the tooth here becomes non-vital as the pulp has become necrotic here. Now what you will see here is a deep narrow pocket which is extending till the apex of tooth at one side. When we see the radiograph of the concerned tooth, periapically the radiolucency may be present and there can be furcation involvement as well. So the main important thing to know about here is the tooth is non-vital and there will be a deep narrow pocket extending till the apex of tooth at one side, and there will be a periapical radiolucency and furcation may be involved. Now moving on to the last point which is left, that is external root resorption. Now as we know, the external surface of root is resorbed, that is called external root resorption. So clinically it is not that important, but when you see radiograph you might see that the root surface is resorbed or there is irregular root surface and the radiolucency can be present. That gives away external root resorption. So we are done with all the options in the diagnosis template. Now what's important about this lecture, we are going to discuss what is important about this lecture is that we are now going to discuss few examples on how to diagnose or how to make a diagnosis based on the information provided in the case history. So what we are going to do is we are going to take only that information which is giving us something about the pulpal condition or the periodontal condition. So we are not taking a complete case here, only the information which is helpful for answering the periodontal and the pulpal conditions. So let us begin. So first example is, let's say we have a tooth 1-6 and it is given that patient is complaining of pain on biting, that is it hurts on biting. Cold test is normal. Percussion test is given, it is positive. Periapical radiograph, there is no radiolucency. And it is given that patient has a habit of pencil biting. Now what we have to see according to this information is that as far as pulp is concerned, here it is given cold test is normal, and cold test is a test of vitality, which is telling us that it is a vital tooth. So pulp diagnosis will be normal pulp as the tooth is vital. Now pain on biting indicates there is some periodontal condition, there is some periodontal inflammation, same as tenderness on percussion is present, which is also indicating at periodontitis. And plus we have a habit of pencil biting, which sort of is pushing us towards choosing the periodontitis. Now it is symptomatic because there is tenderness on percussion, patient has pain on biting, so it is symptomatic. So the diagnosis for periodontal condition will be symptomatic apical periodontitis, and diagnosis for pulp will be normal pulp as cold test is normal here. Now what will be the treatment? Now if they have given there is habit of pencil biting, and in the options they have mentioned this thing that elimination of habit, so go for it. And we have to adjust the occlusion as well. Moving on to next example, let's say we have a tooth 1-5 and it is given in the case history that RCT treatment has been completed on this tooth, post and crown has been placed, and it is said that patient has pain on biting, on palpation there is a slight discomfort, and draining fistula is present. Now diagnosis of pulp is previously treated, as we have discussed in the previous lecture, that we will answer previously treated when it is given that RCT treatment has been completed and the tooth is obturated, and RCT treatment is completed with full obturation, with complete obturation. And as far as periodontal condition is concerned, how will we answer that? As we know, draining fistula is a key here that is pushing us to mark our answer as chronic periapical abscess, because there is a slight discomfort, there is pain on biting, and there is a draining fistula as well. So draining fistula takes us to the abscess part, and if there is no draining fistula, we could have gone for symptomatic periapical periodontitis. But in case of abscess, it is acute and chronic, we know this thing. But in chronic abscess as well, we can have mild symptoms. So the key word is draining fistula, we have to take care of this thing, and there can be mild discomfort, mild pain on biting present as well. Now treatment will be extraction or periapical surgery. Periapical surgery because there is post and crown placement here. Moving on to next example, we are given in the case history that tooth 3-6 has tested negative to the thermal test, negative to the EPT, it is tender on percussion, and there is swelling present. So thermal test and EPT test are the tests of vitality. So the tooth is non-vital, the pulp is necrotic. So for pulp, the diagnosis will be necrotic pulp, and there is swelling and there is tenderness on percussion, which takes us to our diagnosis as acute apical abscess, because there are symptoms or symptomatic apical abscess. I hope it is getting a bit clearer. Now next is Let's say we are given in the case history, there is a tooth. Let's say the tooth is 2-7. It has a draining fistula, and so we know this is chronic apical abscess. Now it is given cold test 2-7 and it is negative. So that means vitality test is negative and it is necrosis. This is a straightaway answer. This was easy. Now 3-7 is pain on biting is present. Tenderness to percussion, it's slightly positive. Radiolucency is present. Now pain on biting present, slightly positive. Tenderness on percussion, like percussion test is positive and there is pain on biting, which is taking us to there is symptomatic apical periodontitis or acute apical periodontitis, as we have symptoms and the TOP positive and pain on biting is suggesting of the inflammation of periodontal condition of the periodontium. Now next question is, in the case history, it is given that tooth 2-6 is endo-treated, swelling is present on the upper left side, TOP positive, palpation positive, radiolucency present. Again, there is swelling, tenderness to percussion positive, palpation positive. So we have symptoms and there is swelling. So it is acute apical abscess. Now next is 3-7. The tooth's number is 3-7. Thermal test is done and it is positive and patient has a very painful response. It is given, patient has a painful response. It is very painful for the patient. And tenderness on percussion is present. Like when you did the percussion test, it is positive. So the pulp diagnosis will be symptomatic irreversible pulpitis because it is very painful and EPT is positive. So TOP positive means symptomatic apical periodontitis. Moving on to next case. Okay, here we have we have a question that teeth given are 1-1 and 2-1 and it is given that cold test shows an exaggerated response and there is enamel hypoplasia. That means there is a enamel, or it is given in the history there is enamel hypoplasia on 1-1 or 2-1, that is areas of dentin is exposed. So straight away your diagnosis will be dentinal hypersensitivity. Dentinal hypersensitivity, as it is clear-cut given in the history that there is an exaggerated response and there is an area of dentin which is exposed. Now our last example here is tooth is 2-6 and it is given that on chewing there is patient is slightly uncomfortable and cold test is negative, tenderness to percussion is positive, radiolucency is present. Now what will be the diagnosis for the pulp? Since cold test is negative, that means vitality test is negative. So the pulp is necrotic. So the tooth is non-vital. So diagnosis of pulp will be necrotic pulp. Periodontal condition, we see there is pain on chewing, pain on biting, and there is percussion test is positive, which is indicating that this is acute apical periodontitis or symptomatic apical periodontitis. So this was all related to the diagnosis standard.